Welcome to Medical Specialists Associates educational series on topics in critical care medicine. I'm Christopher Voss, MD, MS, FCCP, board-certified in anesthesiology, critical care medicine, neurocritical care medicine, addiction medicine, and pain medicine. Alcohol withdrawal syndrome, AWS, is a serious and potentially life-threatening condition that often requires medical intervention. Traditionally, benzodiazepines have been the cornerstone of treatment due to their effectiveness in reducing withdrawal symptoms and preventing complications like seizures and delirium tremens. However, there are significant concerns regarding the use of benzodiazepines, including their potential for dependence, abuse, and the risk of sedation-related complications. This has led to the development of benzodiazepine-sparing protocols as an alternative approach to managing AWS. In this video, we will explore the rationale behind benzodiazepine-sparing protocols, discuss the available alternatives, and review the evidence supporting their use in clinical practice. Understanding alcohol withdrawal syndrome. Alcohol withdrawal occurs due to the abrupt cessation or reduction in heavy and prolonged alcohol consumption. This sudden change leads to a hyperexcitable state in the brain, characterized by increased glutamate activity and decreased GABAergic activity, which can result in symptoms ranging from mild anxiety and tremors to severe complications like seizures and delirium tremens. Benzodiazepines have traditionally been used to enhance GABAergic activity and stabilize the central nervous system during withdrawal. However, the use of benzodiazepines comes with risks, particularly in patients who are elderly, have multiple comorbidities, or have a history of substance abuse. The rationale for benzodiazepine-sparing protocols. Benzodiazepine-sparing protocols are designed to minimize or avoid the use of benzodiazepines in the management of AWS. The primary reasons for considering benzodiazepine-sparing strategies include: chronic benzodiazepine use can lead to dependence, particularly in patients with a history of substance abuse. This is especially concerning in the context of AWS, where the goal is to manage withdrawal symptoms without creating new dependencies. Benzodiazepines are potent sedatives, and their use can increase the risk of respiratory depression, delirium, and falls, especially in older or medically ill patients. Benzodiazepine-sparing protocols often involve the use of medications with different mechanisms of action that target the neurochemical imbalances seen in AWS. These medications may offer a safer and equally effective alternative to benzodiazepines. Benzodiazepine-sparing alternatives. Several alternative medications have been studied for use in AWS, each with its own benefits and limitations. Anticonvulsants, gabapentin, carbamazepine, valproic acid. Anticonvulsants can stabilize neuronal membranes and reduce excitatory neurotransmitter release. Studies have shown that these medications can effectively manage AWS symptoms and reduce the risk of seizures. For example, carbamazepine and valproic acid have been shown to be effective in reducing AWS severity and preventing progression to delirium tremens. Alpha-2 agonists, clonidine, Precedex, Tenex. These medications reduce sympathetic hyperactivity, a key feature of AWS. Clonidine and Precedex have been used to manage symptoms like tachycardia, hypertension, and anxiety associated with withdrawal. Precedex in particular has been noted for its ability to reduce benzodiazepine requirements and mitigate withdrawal symptoms without causing significant sedation. NMDA receptor antagonists, ketamine. As discussed in previous videos, ketamine has been explored as an adjunctive treatment in AWS due to its NMDA receptor antagonism. It helps to reduce glutamatergic excitotoxicity, which is a significant contributor to the symptoms of AWS. Other adjunctive therapies, baclofen beta blockers. Baclofen, a GABA-B receptor agonist, has shown promise in reducing alcohol cravings and withdrawal symptoms. Beta blockers can also be used to control autonomic symptoms, although they do not address the central neurochemical disturbances of AWS. Evidence supporting benzodiazepine-sparing protocols. Research supports the use of benzodiazepine-sparing protocols in specific patient populations, particularly those at high risk for benzodiazepine-related complications. Key findings include Maldonado's benzodiazepine-sparing protocol. Dr. Jose Maldonado's work at Stanford University has been pivotal in developing and implementing benzodiazepine-sparing protocols. His studies emphasize the use of anticonvulsants like valproic acid and gabapentin, along with alpha-2 agonists such as clonidine, in managing AWS. These protocols have been shown to reduce the need for benzodiazepines while effectively controlling withdrawal symptoms and preventing progression to severe complications. Clinical trials comparing anticonvulsants and benzodiazepines. Several clinical trials have demonstrated that anticonvulsants like carbamazepine and gabapentin are as effective as benzodiazepines in managing AWS, with some studies suggesting better outcomes in terms of reducing relapse rates and preventing post-withdrawal symptoms. Alpha-2 agonists in clinical practice. The use of alpha-2 agonists, such as Precedex, has been shown to reduce benzodiazepine requirements in ICU settings, where AWS management often needs to be particularly cautious due to the high-risk nature of the patient population implementing benzodiazepine-sparing protocols in clinical practice. Implementing benzodiazepine-sparing protocols requires careful consideration of the patient's clinical status, including the severity of AWS, comorbid conditions, and risk factors for complications. Key steps include patient assessment. Use validated tools like the Clinical Institute Withdrawal Assessment for Alcohol to assess the severity of withdrawal symptoms and guide treatment decisions. Medication selection. Choose the appropriate benzodiazepine-sparing alternatives based on the patient's needs and medical history. For example, anticonvulsants may be preferred in patients with a history of seizures, while alpha-2 agonists may be more suitable for those with significant autonomic instability. Monitoring and adjustments. Regularly monitor the patient's response to treatment, adjusting the regimen as needed to ensure symptom control while minimizing the risk of adverse effects. Benzodiazepine-sparing protocols offer a promising approach to managing alcohol withdrawal syndrome, particularly in patients who are at high risk for benzodiazepine-related complications. By utilizing alternative medications that target different aspects of the neurochemical imbalances in AWS, these protocols can provide effective symptom relief while reducing the risks associated with traditional benzodiazepine therapy. As research continues to evolve, benzodiazepine-sparing strategies are likely to become increasingly important in the management of AWS. Implementing these protocols in clinical practice requires careful patient assessment, judicious medication selection, and ongoing monitoring to ensure the best possible outcomes for patients undergoing alcohol withdrawal. To learn more about critical care medicine, please visit us on our website at medspecialists.net and subscribe to our YouTube channel.